Hi there, this is Dr. Moyer, and we are covering Chapter 14, which is on the topic of fertility control, or as you may have heard it called, birth control. I want to warn you, students, that there are a lot of slides here, but I will indicate what information you need to know for the exam, because you don't need to know all of it. But in order to give a lecture like this, I have to give you all of the information so you have it. And then you can revisit it on YouTube if you need it in the future, or recommend it to anyone who needs it. Okay? So let's go. So first we'll start with some myths or fact. Then we'll talk about some terminology, and then choosing the right contraceptive method. And that is supposed to say or fact, not of. I hate mistakes like that. Okay, so standing up during or after intercourse does not prevent pregnancy. That's true. That's a fact. Many people believe that standing up during or after intercourse will prevent pregnancy because they believe the sperm will swim down, but sperm does not have any issue swimming upstream, so that is not accurate. Number 2, taking a friend's pill the day of or the day after intercourse will prevent pregnancy. That is a myth. It doesn't work at all, and it could even be dangerous. Number 3, using plastic wrap or plastic bags as condoms is an effective contraceptive. That is a myth. Only water-based lubricants are okay to use with condoms as they don't break down the latex. And using Vaseline, mineral oil, or baby oil in the vagina without condoms can increase the risk of infection for women. It should be avoided at all costs. Okay. So that next one I just said, didn't I? I'm so sorry. Got ahead of myself. Number 5, taking a break from the pill is not necessary. That is actually fact. It used to be thought that women needed a break, that they had to take time off, but this isn't true. There's no scientific evidence for that. And back to number 3, the plastic wraps or plastic bags. They're too loose, they're undependable, they're unsanitary. You absolutely cannot use them as a condom. Number 6, since they're taking daily, oral contraceptives build up in a woman's body, so missing one is okay. That is inaccurate. Missing one is not okay. That's a myth. Pills dissolve in the stomach just like other medications. They don't build up in the body. Number 7, taking birth control pills makes women fat. That is actually a myth. New research has indicated that birth control pills do not cause weight gain, contrary to popular myth beliefs that it does. Number 8, the sponge is just as effective as the pill at preventing pregnancy. That's actually a myth. The sponge does not have the effectiveness of the pill. Number 9, if allergic to the latex in condoms, a good strategy is to use a lambskin condom on the outside over a latex condom. That's a myth. Never, ever, ever wear 2 condoms. It actually creates friction and is more likely to rip. It's worse than wearing one. Than not wearing one at all. Fact or myth, number 10, the side effects from the pill are likely to subside over time. That's a fact. They will likely go away after a few months, and if not, the patient should review their options with their doctor. Okay, number 11, St. John's wort can reduce the pill's effectiveness. That is actually a fact. It can definitely reduce the pill's effectiveness, as can antibiotics. Always check with your doctor and the pharmacy if you're taking the pill to see if any medications will interact or affect the pill's effectiveness. Number 12, a condom can get lost in a woman's body. That's actually a myth. Condoms are too big to pass through a woman's cervix, so they can't get lost, but they can come off and get stuck inside a woman's vagina. If a woman starts panicking, then she may clench up and it may be hard to retrieve. But if she relaxes and is patient, the condom will move down to where she can reach it. Number 13, breastfeeding prevents ovulation, protecting a woman from getting pregnant. This is actually a myth. It does actually lower ovulation or reduce the chances of ovulation occurring, but it isn't foolproof, and many women have become pregnant while breastfeeding. 14, urinating after sex is an effective way to prevent pregnancy. That's a myth. It has no effect on pregnancy risk at all, but it actually can reduce the risk of infection, so it is a good habit to get into. 15, a woman beginning the pill should use a backup method of protection during the first month. That is fact. Absolutely use a backup method for at least the first month, just in case. Okay, some terminology that we should cover. Family planning. This implies a desire to have children at some point in time. So when people use this, they're talking about planning out when they have children. Postponing childbearing until it's desired, spacing subsequent births, and avoiding pregnancy at other times. Contraception refers to all methods designed to prevent conception or fertilization. Contraceptive methods work by preventing the sperm and the egg from uniting and causing fertilization. Birth control is a broad term that encompasses all methods designed to prevent pregnancy and birth. Includes all contraceptive methods, post-conceptive methods, and abortion. Okay, this slide is actually very important for the test. Choosing a contraceptive method. So there are many, one size does not fit all. There are many issues associated with choosing the right method for you, and all 6 of these need to be considered. The first one is the safety, and that's actually the most important factor. So nothing should create any health risks for either partner, and it should pose minimal side effects. The second one is effectiveness, also extremely important. No method is 100%, so it should be maximal in preventing pregnancy. The ease of use, how easy is it to use? For example, IUDs are placed in the body by a professional. The birth control pill, requires a prescription. Condoms can be purchased over the counter. Some devices have to be inserted prior to sex play or intercourse, and others at the beginning. It just depends. Make sure you consider these factors. Acceptability, in terms of a partner's medical history, what is acceptable, their physical comfort, their religious viewpoints, and even just personal preferences. What are they willing to do? To some women, it's not acceptable to deal with the diaphragm. To others, it's fine. The reversibility. So a person might want to retain the option of becoming pregnant in the future. So having their tubes tied or a male having a vasectomy would not be a good option for people that have that desire to have children in the future. So if it's not reversible, probably not a good idea. Then finally, affordability and availability should be a cost that the user can afford. Pills and diaphragms are available by prescription only, so they're not easy to just get, where condoms and suppositories are available over the counter, and even some methods are free. So it just depends. All of these should be taken under consideration. Again, safety is the most important one, but they're all important when you're thinking about what is the best way to prevent pregnancy for me. Okay, the first type we'll cover, and again, it's not important that you remember all this information. I'm not even going to go over all of it. I'm just going to point out what this means. Low-tech and no-way methods typically involve just either refraining from intercourse or using the withdrawal method. It can actually mean, charting your fertility chart, fertility awareness. So these are, inexpensive, and I put typical use versus perfect use because there is the perfect use theoretically, but then there's typically what happens. So the first one we'll talk about is abstinence, and the effectiveness, if it's used perfectly, it's 100% effective. Some argue that this really isn't a birth control option because it's just abstaining, so you're not using anything to prevent pregnancy, you're just not engaging in sexual activity. And then there's a famous study that was conducted regarding pregnant teens in Texas. Note, pregnant teens. Over 70% said that abstinence was their fertility control method, indicating that this is not a very effective fertility control option. So advantages, it is effective when 100% effective when used right. No STDs if used correctly, no hormones or chemicals, can intensify sexual desire, and it's free. The disadvantages might lead to feelings of loneliness and sexual frustration. There's no clearly defined definition of abstinence, difficult to adhere to, question about whether it's really a method or is it a choice. Fertility awareness, there's actually 3 types. There's charting the menstrual cycle and avoiding sex during ovulation, charting the body temperature, because there is a drop in temperature before ovulation, 12 to 24 hours prior, or charting cervical mucus. Near ovulation, mucus changes from cloudy to clear and slippery, much like the consistency of egg whites. As far as effectiveness, the typical use is it's about 80% effective. So there are some advantages. It does help a woman know her body. There's no chemicals or hormones. It is free. The disadvantages, though, is that the failure rate is pretty high. Requires somebody who manages their time and manages record keeping effectively. There's no protection from STDs. Can lead to sexual frustration, and menstrual cycles unfortunately vary a great deal, cannot always be counted on. So here's an example of charting when it would be okay or safe to have sexual intercourse. But I do want to point out that, again, menstrual cycles are not always dependable, and many women do ovulate at the beginning or end of menstruation, so they can become pregnant. As far as body temperature, you can see here how it drops during ovulation. Again, it's kind of sketchy to me, but many women do use these methods because of the advantages I pointed out earlier. Withdrawal effectiveness, typically it's about 81% effective. What this refers to is if it is a male and a female engaging in sexual intercourse, and the male would pull out before he orgasmed. And so the idea is that the semen would actually not ever be in the vagina. Unfortunately, there is pre-ejaculatory fluid that can carry sperm, and women do become pregnant this way. So that is a major disadvantage. And it's also really hard for men to pull out or to predict ejaculation. It may occur before they're planning on it. There's a high failure rate. It requires severe discipline, kind of interferes with being spontaneous, can even create tension because there's always this worry of failure. But the advantage is, it's free, there's no hormones, can be done anytime in any circumstance, and it's the male's responsibility, not the female's. So that is the low-tech or no-tech ways. This section concerns barrier methods, when you put some type of barrier to prevent the semen from actually entering the cervix and potentially the fallopian tubes and causing conception. So we'll start with the condom, the most famous one. The effectiveness, typically it's about 85% effective, but used perfectly, it can be up to 98% effective. Many people don't realize that because they go by just the 85%, the typical rate. There are what we call 10 steps to using condoms effectively. If you look those up, if you Google that, you'll find a list of how to use a condom effectively. It involves checking the expiration date, making sure, inspecting the condom to make sure there's no holes in it, not using them if they're really old or the package is worn, using them with the lights on, making sure that that the right side touches the penis and not the other side, because it can be contaminated that way with semen. And so, there are a number, squeezing enough room at the top for ejaculation to occur so it doesn't slip out. It sounds like it's a lot, but if used correctly, it can be very effective. Some advantages, it's easy to buy. You can go just to a store and buy it. No side effects unless somebody's allergic to latex. And then there are lambskin condoms, but they're not as effective. The condom also, one of the major advantages of it, and many people use it in combination with other methods because of this, is it does protect from STDs or STIs, sexually transmitted infections as they're now called. And so after HIV came on the scene, many people would engage in what they call safe sex, which is using some type of male condom or the female condom to specifically protect from STDs, not just pregnancy. Before that, it was just used to protect from pregnancy. Can share the responsibility. The disadvantages, it requires motivation and consistency for effective use. The typical use has a relatively high failure rate because people don't follow the 10 steps. Some males report that it leads to a loss of penile sensation, and prompt withdrawal following ejaculation is required, and many people don't like that. So, your choice. This is the male condom, and you note at the top, you know how I indicated earlier that males have to squeeze out the air at the top, so that leaves room for the ejaculatory fluid, and that's an important step. And also making sure that only this part, the underpart that you roll down, touches the penis, because if it touches the other side, it does become contaminated or potentially contaminated, and a pregnancy could result. Many people are unaware of that and don't even take that under consideration, but it is very important. There's also the female condom. Many are not aware of what a female condom is, but as you can see, there's a picture of one here. It looks kind of strange, but it actually is pretty easy to use. The effectiveness, the typical use is about 79% effective. Some advantages, there's no side effects unless, again, there's an allergy to latex. It is reversible. It's available over the counter. Relatively inexpensive, although much more than male condoms. And then the female, probably the most important advantage is it gives the female control, and there's no hormones. And so a female does not have to rely on a male to bring a condom. She has one in her possession and can use it if needed. Unfortunately, there is a high failure rate with the typical use. It does, just like the male condoms, there are steps that need to be followed to using it effectively, avoiding contamination. It's a pouch that's worn, well, as you can see, it's a pouch, but it's worn inside of the vagina with the 2 rings, one ring fitting loosely over the cervix, similar to a diaphragm, and then the other ring at the open end at the sheath remains outside of the vagina and is supposed to cover all of the labia to prevent pregnancy. But in real life, it can be difficult to use. Most women are not familiar with it. Males are not familiar with it, so it's not as easy to use as the male condom. And it can actually be expensive. With the female condom, it's actually critical that lubrication is used with them, a water-based lubrication. And this is not the case with male condoms, but female condoms are more likely to slip than male condoms. And so experts recommend that always a water-based lubrication is used to prevent that slipping from occurring. Okay, the diaphragm is just a shallow round dome made of soft latex. It's about 2 to 4 inches in diameter. It's placed inside the vagina to cover the cervix and uterus and block the sperm from entering the uterus and causing pregnancy. It is used with a spermicide, and the typical effectiveness is 82%. Some advantages, it can be inserted before intercourse, which can be a major advantage for women. If they are concerned with seeming, like they're prepared because they had some sort of, the female condom with them ahead of time, they're worried about what their partner would think. This allows them to put it in and do it ahead of time so that no one knows. It does, and then another big advantage for the diaphragm is it reduces the risk of pelvic inflammatory disease, or sometimes called PID, and it is reversible. Of course. Some disadvantages, it has to be sized and fitted by a healthcare professional. It does require some skill. It needs proper care as far as the storage and the cleaning. It doesn't offer very much protection against STIs or STDs, and it has to be left in place at least 6 hours following intercourse, which can be problematic for people. And this is how it is inserted. It fits over the cervical opening, prevents the sperm from entering the uterus. It requires some skill, but it's not super difficult to manage. This shows you just kind of how that's done. Like here's prior to insertion, the squeezing. the pushing up, and then you see, sorry, it fits over the cervix and prevents the sperm from entering the uterus and thus fallopian tubes. A cervical cap is actually very similar to a diaphragm, but it's smaller. It's like a thimble. Many women find this more convenient to use and easier to use. The effectiveness is about the same. The advantages and disadvantages are about the same. You do have to replace them. They are, some say they're more difficult to use in a diaphragm because they're smaller, and that there's an issue of odor development and possible toxic shock syndrome if left in place too long. And this is because it can actually be inserted 2 days prior to intercourse, and it also can be left for 2 days after. And that can be a major advantage for some women. And this is just an example of what a cervical cap looks like. Again, it's just a small thimble shape, very similar to the diaphragm, but again, it's smaller, and it can be put into place much earlier and left into place longer, but then again, there's the risk of infection. Then there is the Today Sponge. You may have heard of the Today Sponge on the Seinfeld show. There's an episode where Elaine actually goes and buys out all the sponges because they stopped producing them. They are still produced. You don't typically find them very often in drugstores, but you can order them online. And I've actually seen them in some drugstores, so it just depends. Women found this pretty convenient. It's pretty effective if a woman has never given birth. 91% effectiveness if a woman has never given birth, and it drops to 84% if they have. And if used perfectly, the effectiveness can go up to 99%. So, pretty effective. But again, that's the typical use. So, how it is put into place, it does actually have the loop, which is used to pull it out. And it's very similar to the diaphragm and the cervical cap. It's just put into place, and it contains the spermicide, so you don't have to use that separately. Many people find that convenient. It is relatively effective. It can be worn up to 30 hours after being put in place, which is convenient. Relatively inexpensive. I don't know, that's debatable. But women like the convenience of it. It doesn't offer very much protection against STDs. It can actually irritate the genital tissue for some women, increase the risk of yeast infections, and there is a residual taste if oral intercourse is engaged in. Some women say it's difficult to insert and remove. Others say it's easy. It just depends. So here's an example of the sponge picture so you know what it looks like. Here's the sponge itself. This is the cord that's used to pull it out. You can see it's very similar to the diaphragm, but again, it's this little spongy thing that's already filled with the spermicide, and then it's put into place, and then it can stay there for a while, and it can be convenient for women. Using just vaginal spermicides on their own, not super effective, but generally very convenient. So these are just chemicals that kill sperm. They can come in foam, gels, creams, jellies, suppositories, film, etc. They come in many different ways, and they can be purchased in just about any drugstore. Again, it's convenient because it's easy to use, but it's not super effective. It can actually irritate the genital tissue and increase risk of infection. And if oral intercourse is engaged in, there is that residual taste that can cause problems. So, intrauterine devices, or IUDs. These are small 1 and 1.5 inch devices that are inserted in the uterus by a doctor. What happens is it immobilizes sperm as they migrate from the vagina to the fallopian tubes. There is a string that women can check to make sure it's in place. As far as effectiveness, it's actually very effective. There's not much to do once it's put into place by a doctor. It's just there. And so the effectiveness, women don't have to mess with it at all. And there are 3 different kinds. There's the copper T, there's the progestin T, and there's the Mirena. It just depends on your needs as to which type the doctor selects with you. As far as advantages, like I said, little attention's needed. It can actually cause this nice side effect of reducing menstrual flow, either a great deal or altogether. So women do sometimes prefer it for that reason, and many women actually will use it for that reason, not just for birth control. The disadvantages: it is initially expensive. It does need to be replaced. It doesn't offer any protection against STDs. Up to 20% of initial users expel it. Their vagina expels it without them. There's no control over it. And if there is a pregnancy, spontaneous abortion or miscarriage can occur. So this is just an example of what they look like. I realize that looks a little scary, but you don't feel it once it's in place. So it isn't as scary as it seems. It just looks a little scary. And here, what happens is the lining of the uterus is thinned, which is why it reduces the menstrual flow, and sometimes it can stop it altogether. And this inhibits sperm movement, so it can't get to the fallopian tubes and cause pregnancy. And there's also the thickening of the cervical mucus, which prevents sperm from even getting up there. So lots of ways it works. Then we move into hormonal methods, which are typically very effective, sometimes referred to as the pill or oral contraceptives, which can be delivered in a number of different ways now. It doesn't just have to be a pill. Very effective with typical use, meaning if you fail to take your pill on time, you use a good backup method. I'm sorry, that's typical use is not doing this. Perfect use is if you do miss a pill or you're late taking one, you use a backup method. If you're taking antibiotics or any St. John's wort or something that interferes with it, you use a backup method. And you're very good about taking the pill the same time every day. It can be up to 100% effective. So it is actually very easy to use. It's relatively expensive because you do have to get a prescription. Some women do experience some side effects, but they typically do pan out over time, and so they go away and get easier to cope with. Basically what's happening is it just lowers the level of estrogen, so it prevents the pituitary gland from releasing LH, and without LH, the egg does not mature and ovulation doesn't occur. Of course, you don't feel any of this, it just ends. Like I said, it can be delivered in other ways, and many women find this much easier than having to take a pill. Back in my day, these options weren't offered, so you just had to suck it up and swallow the pill. But now you can implant them, Norplant. You can do a mini pill, you can do a patch, and the effectiveness varies. The effectiveness I've given you here is for typical use. Okay, this next part, postcoital contraception, is important for the purposes of the exam, so you do want to pay attention to this aspect. Also, this information is covered in your textbook, so you can use that as well. There are actually 4 options for after intercourse has occurred. Many people are not aware of that, but sometimes intercourse occurs and you weren't prepared for it, and there are some options that could be considered. The first one is called Plan B, emergency contraceptive pills. And so this is used as a backup method for preventing pregnancy. It's not supposed to be used as a regular form of birth control, and you can't just do it yourself. You can't just take a bunch of pills. So when women are sexually assaulted, they're almost always given emergency contraceptive pills or backups. They're not an abortion pill. That's a myth. It prevents pregnancy, but it won't terminate a current pregnancy. So there's a lot of misconceptions about that. People say that it causes miscarriage or abortion, but it doesn't. It's available over the counter for women 18 and older, and then a prescription for women under 17, although I believe that has changed recently. And I was meant to follow the law. I didn't follow it closely enough, but I believe now women 16 and over can get it over the counter. It has to be given within 72 hours after the intercourse, unprotected intercourse has occurred, and it's given in 2 doses. So it's actually critical that it's done immediately. RU486 is what people refer to as the abortion pill. It's a medication that blocks the action of the hormone progesterone, which is needed to sustain the pregnancy. It has to be taken during the first 49 days of pregnancy, so it's not an option after day 49. And it requires 3 doctor visits. So day 1, 3 doses of I'm sorry, I'm noticing that I have another error in my PowerPoint. It always distracts me. Are given orally. Day 3, a follow-up visit has to occur to see if abortion has occurred, and if not, more of the pill is given. And then 14 days, there is another post-treatment examination. So it has to be given under the supervision of a doctor. It can't be taken just on your own. And again, I don't know how you feel about abortion. This is just an option. It doesn't mean you have to like it. It's one of the options available. There's also a postcoital IUD, which is very similar to the regular IUD, but it's inserted within 5 to 7 days after ovulation when an unprotected intercourse has occurred. It's not recommended for women with multiple sex partners, women who have never been pregnant, or women with a history of either a tubal pregnancy or PID, but it is an option if you don't fit that criteria. And then there's abortion, which is the choice to actually surgically stop a pregnancy or abort a fetus. And again, doesn't matter how you feel, these are the choices. You need to be aware of what they are. And those are the 4 options. This material also is important to be aware of. Information about abortion, so we'll focus a little bit more on that. It is a topic of considerable controversy in the United States, but you do need to be aware as taking a sex education course about abortion and what's going on with that. There's 2 kinds. There's spontaneous abortion and there's elective abortion. A spontaneous abortion is typically called a miscarriage, and it actually occurs quite frequently. An elective abortion is the choice to terminate a pregnancy. You may not be aware, but almost 1 in 4 pregnancies are terminated in the United States through elective abortion. This right was given through the Roe versus Wade policy in 1973, when the Supreme Court ruled that women had a right to a safe and legal abortion. Before that, a woman oftentimes would try to abort the baby on her own. So she might seek an illegal abortion or try dangerous methods that are unsanitary, primitive, using coat hangers or herbs or other unclean instruments. And so the government ruled that a woman has a right to go to the doctor and have this done so that she doesn't put her life at risk. And so, I don't know, it's important to realize how, what's legal and what isn't. There's a really lot of controversy about partial birth abortions. That's this here. The Partial Birth Abortion Ban Act of 2003 banned intact dilation and extraction, an intact fetus removed after the dilation of the cervix, the collapse of fetal skull to remove the fetus. But it's important to know that actually it was only administered in about 0.1% of all abortions. And only when there were severe fetal abnormalities or there was some kind of serious health risk for the mother. So it wasn't a type of abortion that was used all the time, which is another misconception. Abortions are always talked about by anti-abortion groups as though this is the type that always occurs, but it's actually not true. So the Partial Birth Abortion Act banned this types of abortion. It was signed into law by President Bush in 2003. As far as the incidence and prevalence of abortion, 3/4 of the people in the whole entire world live in countries that allow elective abortions. The demographics of women that choose abortion, most are unmarried. Most are between the ages of 20 and 24, so over half. There's a misconception that it's all teenagers doing it. Only about 20% are 19 or younger. Most have had a previous live birth, meaning they have a child, or have given away a child through adoption. 90% have had 2 or fewer live births, and 15% have had at least 2 abortions. So there's a lot of misconception about women using it as a form of birth control and having multiple abortions, never having children, but continuing to use abortion as a method. It's inaccurate. It's important that you understand what the facts are, and these are some facts to be aware of when it comes to demographics. The average woman that seeks abortion is 24 years old, has never had an abortion, is unwed, is living either a little bit over the poverty level or could be living in poverty, is Christian, and is already a mother. You may be surprised by this demographic, but those are the facts. Typically, abortion occurs around the 8th week of pregnancy, when a lot of women are not aware that they're even pregnant until about the 6th or 7th week. So this is not unusual, and women will, if they decide to seek an abortion, they will do so immediately. They don't put it off and wait until the 6th month. You can't even do that anyways. Most unplanned pregnancies end in abortion. It is an option. It's a choice for women to control when they have children. And although abortion rates are generally low in culturally conservative states, they are still high. And when parents learn that their adolescent daughter has an unplanned pregnancy, they actually favor abortion over birth by a ratio of 4-1. So this is actually a very private decision. I would be careful how you talk about abortion around other people, because you don't know who's had one. And it can be something that it is controversial, and you don't want to just put your foot in your mouth. It's a choice, whether you can believe in a woman's right to choose but be against abortion. So that means that you believe women have a right to choose for themselves, but you yourself may not ever choose abortion. But just know the facts, be aware, so you know what's happening. Again, it is a complicated and serious decision. Feelings of ambivalence are typical. There can be some feelings of anger, of loss, of regret, depression. And most of these are actually prior to having the abortion. Most women, once they choose to have an abortion and go through with it, they actually report feeling very relieved. And it just relieves a lot of the depression, the anger, the ambivalence they were feeling before. So why do women choose to have an abortion? The 3 top reasons are because they felt that they were too young to care for a baby, they are trying to complete their education, or they experience some kind of economic hardship. They don't think they can afford it. So not just, because I don't feel like dealing with a baby. Actually, many women do take this decision extremely seriously and think about all the pros and cons before they go through with it. After an abortion, every woman is unique, and I'm just going to give you what most women experience, understanding that this is on average. Understanding emotions can help women begin to let go and heal. Most women don't experience severe negative psychological responses to abortion. And so there is this misconception that women are experiencing extreme guilt or sorrow, and they have all this negative mental health, poor mental health following an abortion. Most women actually report feeling happy, relieved. They feel a sense of resolution and even self-efficacy, feeling as though they're competent enough to make a very important decision like that. If a woman does experience negative psychological responses, they typically fall into one of these 4 categories. So they believed the fetus was not a human being, but changed their beliefs following the abortion. They believed that the fetus was a human being prior to the abortion, but proceeded with it anyway. They were heavily pressured by a partner or family or friends or other circumstances into having an abortion that they didn't want to have. Or they did not receive adequate counseling and or information about abortion and other options before the abortion. So when women do experience any negative psychological responses, they fall into one of these 4 categories, which makes sense if you read them and understand them. When it comes to men in abortion, unfortunately, the man is typically forgotten in the decision and sometimes is not even allowed to contribute to the decision. And men can experience powerlessness, guilt, and anxiety. Women may take out some of their own emotions on their partner because of the experience. The male often believes that he has no influence, or he shouldn't influence his partner's decision. After the abortion, some men report guilt, sadness, and remorse, and some may even experience erectile or ejaculatory problems due to this experience. Most couples actually break up following an abortion. It is unfortunate, but it is what the research shows us. So it's hard. It's a decision. I guess what I'm kind of trying to point out here is, although it is a decision that probably a couple, if they are together long term, should make together, it is typically the woman that is left with the child care and the cost and the raising if there is a separation. And so I'm not saying that men shouldn't have a choice, but it's not the male that has to experience a pregnancy and is not typically the one that is raising the child. So, it's a little controversial for men to decide about what's happening when it comes to abortion. When it comes to the abortion debate, I just want you to be aware of the key arguments for both approaches so you can think critically about this issue, which means you're considering both sides. The pro-life position, the key arguments are from conception that egg is human and has rights, and that abortion should only be used to save the life of a woman, and that if we are going to legalize abortion, why don't we just legalize the killing of individuals with disabilities, the elderly, or anyone else who is inconvenient. The pro-choice position key arguments are who decides whether a woman will bear children, the woman or the government. And again, I point out pro-choice does not mean pro-abortion. Another key argument is that women bear the burden of child-rearing and should have the choice, what I was kind of talking about earlier, previous slide. No contraceptive method is 100% effective, so women should have this choice if their contraceptive method fails or doesn't work. And even if abortions are made illegal, probably this is one of the most important points, women will still get them. They'll risk complications, infections, and death. And the women that will be affected the most are the women that suffer from poverty. They won't be able to afford to obtain one in a country where it's legal, like women that have more wealth. So those are the two arguments. I do want you to be aware of everything we've talked about with abortion. It could potentially be on the exam. But as far as the actual types of contraception, that's really kind of an FYI. I just want you to be aware of how to choose them. Okay, that concludes this PowerPoint. Sorry it's so long.